project is about maintaining the nutritional status of cancer patients. Good nutrition is important for all people and patients, but it's especially important for patients undergoing chemotherapy and cancer treatment. According to the National Cancer Institute, indicators most recognized as being predictive of poor outcomes include weight loss, wasting, and malnutrition. Significant weight loss at the time of diagnosis has been associated with decreased survival and reduced response to surgery, radiation, or chemotherapy.
Cancer treatments may affect nutrition. For many patients, the effects of cancer and cancer treatments make it hard to eat well. Cancer treatments that affect nutrition include surgery, chemotherapy, radiation therapy, immunotherapy, stem cell transplant. When the head, neck, esophagus, stomach, or intestines are affected by cancer treatment, it is very hard to take in enough nutrients to stay healthy. Some side effects of cancer and cancer treatment that can affect eating include anorexia, which is loss of appetite, mouth sores, dry mouth, trouble swallowing, nausea, vomiting, diarrhea, constipation, pain, depression, and anxiety.
Both nutrition therapy and medicine can help the patient stay at a healthy weight. Medicine can be used to help increase appetite, to help digest food, to help muscles in the muscle of the stomach intestines contract, to prevent nausea and vomiting, to prevent and treat diarrhea, to prevent and treat constipation, to prevent and treat mouth problems such as dry mouth, infection, pain, and sores, and to prevent
especially those undergoing chemotherapy and or radiation are susceptible to dry mouth, bleeding of the gums, mucositis, stomatitis, and oral discomfort associated with vomiting. To promote comfort, help prevent infection, and to improve the ability and desire to eat, it's important to perform frequent oral care. If the patient cannot perform his or her own oral care, the nurse must help or perform it for the patient.
4 times per day after each meal and before bedtime. Brush and rinse dentures after each meal. Keep water handy at all times to moisten the mouth. Avoid rinses containing alcohol. Consume very sweet or tart foods and beverages, which may stimulate saliva. Drink fruit nectar instead of juice. Use a straw to drink liquids, and don't forget to use your lemon swabs.
Patients are unable to eat, but it's still important that the patient receive proper nutrition. With the doctor's orders, a G-tube can be inserted and the patient can receive enteral feedings. TPN can also be prescribed by a doctor and administered by a nurse.
The nutrition section of our presentation, we're going to go over some foods that cancer patients should eat and foods that they should stay away from. You want to tell a cancer patient to stay away from carbonated drinks and any foods that may cause gas. For example, beans, peas, broccoli, cabbage, Brussels sprouts, green peppers, radishes, and cucumbers all causes gas. They should stay away from that. Cancer patients to increase their calories by frying foods. Now, any other time, that wouldn't be good. But for a cancer patient, fry those foods. Use gravy, mayonnaise, salad dressings as much as you like. Use supplements high in calories and protein. Choose high protein and high calorie foods such as eggs, cheese, whole milk, ice cream, nuts, peanut butter, meat, and poultry.
Welcome to Albany Medical Center. Now that we've had an overview of nutrition and cancer patients, we're going to go see a nurse who's actually taking care of a patient right now.
Hello, Miss Shelton. Hi, I'm Michelle Castro. I'm your nurse.
Okay.
I brought a pamphlet in that's going to go over your nutrition to let you know what foods you can eat and what foods you cannot eat. And you're drinking soda. This is not good for you. Coca-Cola, it causes gas.
You might drink it for my nausea.
But we ordered Zofran for you. If you're feeling nauseous anytime, you can take your Zofran. That'll help you. And then it'll stop your nauseous. You'll be able to eat. And this pamphlet,
I've been eating.
but are you eating the right foods?
No.
Have you been eating any beans?
I eat beans.
Okay, but beans and Coca-Cola, it will tear up your stomach and you'll be gassy all day. And you might not want to eat again.
I know.
So you shouldn't eat that. So let's talk about something healthy, like a good meal, like eggs and cheese and some nuts on the side, something healthy. How does that sound?
I don't like nuts.
Okay, you don't have to eat nuts. You can eat any kind of meat, lean meat.
I like steak.
Okay, that's good. You can eat steak and
fried chicken.
chicken. Fried chicken is good. Any other time, we would not tell you to eat fried chicken, but for you, you need all the fried chicken you
Well,
can
my doctor
possibly
told me I
eat.
shouldn't eat fried chicken.
But you need fried chicken when you're having chemo.
Oh, yeah.
For chemo.
Okay.
Prior to chemo.
Okay.
So when you go through chemo,
You
you
get nauseous. You know, I hear a lot of people say you get nauseous with chemo, and I only had so I can't eat fried chicken,
You can eat fried chicken.
but it burns my mouth. Like the last 2 times I had my chemotherapy, and I ate fried chicken, it really burnt my mouth.
Burn your mouth out. Was
And
it
my
too hot?
tongue, yeah, something just like I feel like I'm getting sores in my mouth or something.
Okay, well maybe if the chicken bothers your mouth, then maybe try not to eat the fried chicken. But in this pamphlet here, it goes over mouth sores and infections. And it says here, you can eat soft fruits, like bananas, applesauce. You can eat macaroni and cheese.
That's good.
You like macaroni and cheese?
I love
You
it.
can eat macaroni and cheese. Try some gelatin, some milkshakes.
And I love milkshake.
Milkshake bring the boys to the yard.
Oh,
So do you have any questions?
yes, actually I do. Is there anything I could take for constipation besides just keep drinking this water?
Well, water is good, and yes, you should eat foods high in fiber, like oatmeal, bran, beans, even though we said it would cause gas. But in the case that you're constipated, you want to eat maybe just a little bit to help you go. Fruits, veggies, whole grain breads, all high in fiber. Anything else?
Yeah, actually, that's how my mouth been hurting. Like, I know we have to brush our teeth maybe a certain way, or like, what, any kind of advice for my mouth?
Yes, since you're going through chemo, how many sessions have you been through already?
I had 2 sessions already. I lost a little bit of hair just in front.
Okay.
Am I also able to eat sushi? I love to eat sushi.
Sushi, as a patient going through chemo, your foods have to be cooked completely. You cannot have any raw foods because of your immune system. So if you're going to eat sushi, you make sure you tell them to fry it, because frying is good. So is that all?
No, also my mouth been hurting. Is there anything advice for my mouth? Like it's feel like it's when I'm eating or something's burning, or is there any special thing I need to do for my mouth?
Well, what have you been doing before you go into chemo?
Just brushing my teeth and using mouthwash.
Well, here on this packet again, it tells you you need to perform oral hygiene at least 4 times a day. You want to brush and rinse your teeth after each meal. You want to keep hard candy with you, so in case your mouth gets dry, keep it moist, so you won't get open sores in your mouth. You want to consume very sweet or tart foods and beverages so you can stimulate the saliva production in your mouth. So you want very sweet stuff so you can get the saliva flowing. And use a straw to drink like you're doing right now. That's a good job. Use a straw. Okay? Well, thank you for coming in
I
today.
have one more question.
Oh, okay.
Can I have my Coke back?
No, well, I can't tell you no. I can't deny you your Coca-Cola, but it's not good practice.
I know, but I'm thirsty. Thank you.
Thank you for coming in.
Thank you so
Wish you
much.
luck in your treatment.
Thank you.
Oh, and here's your packet.
Thank you so much.
Have a good day.
Presentation. Thank you for joining us. When we're finished, we're going to do a quick quiz to see how much you've learned.